Hello, good morning, everyone. My name is Alison Williams, and I'm a faculty member in the Faculty of Science at McMaster University. I'm trained as a social scientist and do work in health and labor geography. I also do work in social geography, and I have the pleasure of co-presenting with my PhD student, Regina Ding, who will be introducing herself partway through the presentation when she takes over the slideshow. I just wanted to recognize that our funders are the Canadian Institutes for Health Research, as well as the Social Sciences and Humanities Research Council of Canada. And the work that we're presenting today is based out of a partnership grant that's co-sponsored by SSHRC and CIHR, as well as an additional 20 partners across the country and the globe, including the Canadian Home Care Association, Carers Canada, Carers UK, as well as Carers Australia. And so the work we do at McMaster University is really about engendering a care-friendly workplace. And that's really based on the fact that many opportunities that were once available through the state are no longer available. So back in the 1970s, for example, we had a lot of care being provided in institutions where a lot of elderly people were cared for in hospitals. But as we've moved towards the 21st century, there's been a move towards community care and the institutionalization of our elderly family, friends, and loved ones. And as a consequence, there's been a transfer of responsibility to families. And consequently, what we have right now is 1 in 4 Canadians providing informal care. That's unpaid informal or family care, with 6.1 million of those juggling work at the same time. And this is really the focus of our talk today: is the care worker, or the care employee, as what we call them, the care employee, or the CE. As obviously workplaces have a role to play in maintaining work-family balance, and part of that family balance is the care for elderly family members, as well as adults with adult children, for example, with chronic conditions such as autism. We also know from, again, our Statistics Canada census data that half of carers in Canada are between the ages of 45 and 65. So they're not only in their peak earning years, but they're also the most experienced employees, where, again, lots of training and investment has been made. So clearly not employees you want to lose. We also know that the majority of carers and care employees are female, given the gendered expectation to care, although increasingly more and more men are doing this work due to, again, changes in our society and expectations, in addition to, again, smaller family sizes and an increasingly mobile workforce, which I assume will pick up again post-COVID. We also know from the larger national research that up to 80% of community care for older adults is provided by unpaid informal carers. Again, that transfer of responsibility from the state to families continues to grow. And we also know that carers are also financially on the hook, spending $12.6 million annually in caregiving expenses, whether that be specific to gas, to travel to care, or specific to pharmaceuticals, oxygen machines, any technology in the home, as well as household bills, and so on and so forth. So the question about COVID and the impact that COVID has had, clearly it's been a monumental impact in society as a whole, and certainly on work, but it's also impacted caring. And so when you have workers come back to work, you'll find that they're more likely to talk about their caregiving role. And that's because COVID has clearly impacted their caregiving role. And data from the United Kingdom suggests that there's been an increased demand to care, with approximately 10 hours additional per week to add to the caregiving burden. There's also increased financial pressures, specifically around money spent on food and household bills. There's also been an impact on mental health, with carers feeling overwhelmed and worried that they may burn out, given that they really can't share the care anymore. Sometimes they are the primary and only carer. There's also been a great degree of grief and bereavement experience, given the thousands of lives lost, particularly aging family members, friends, and neighbors. So many of your employees may, in fact, be experiencing grief. And there's also been changes to the provision of formal care. And certainly in the UK, there's been a drop in the provision of paid or public formal care. And we've also been hearing stories about that happening within Canada and Ontario specifically, with the system believing that if the primary informal care is working from home, for example, then they're much more available and likely to provide the informal unpaid care that formally would be provided through the public system or through, again, the LIN, previously known as the Community Care Access Center. So again, the carer employee, we're talking about individuals working in paid employment while also providing informal care simultaneously. We also know that 1 in 4 of these carer employees are also providing care to young dependents, so their parents as well as carers. We also know that they're a growing employee group due to the increase in the number of dependent elderly in our demographic. And they often experience role conflict as a result of, again, the responsibilities to their paid workplace, as well as the often increasing number of unpaid caregiving responsibilities, as well as, again, their core responsibility for keeping themselves healthy and well through self-care. Not to mention, again, those who are providing parenting and, again, domestic household management, and so on and so forth. So in again, the field of social science and specifically labor and health geography, we talk about spatial and temporal tensions, meaning you can only be in one place at one time. It's very difficult to be able to navigate multiple places. And so in some ways, when workers were working from home or may continue to work from home, they may in fact be better navigating the spatial tension, but they may have more tension specific to the time tensions, given again, there may be greater expectations for them to provide care while also working from home. But at the end of the day, what these care employees experience is role conflict or role strain, which leads to burden and sometimes moves into, again, poor self-care, which may exacerbate into mental health issues such as depression and anxiety, and ultimately can in fact impact their physical health. And so one way that we can prevent this from happening is putting in sufficient workplace supports in order to, again, prevent these health, interpersonal, and economic consequences. So again, my research group at McMaster has been focusing on this area for some time now, recognizing that the state or the government has very little supports in place for carers, and due to families getting smaller, more mobile, and more women in the workforce than ever before in our history, the workplace consequently has a key role to play in ensuring work-life balance for these care employees. And so what we've been trying to do is really engender the opportunity for workplaces to nurture a care-friendly culture within their workplace through having employees identify as carers and seek the supports needed in order to ensure ongoing employment. As what we notice as care employees subsume increasing caregiving roles, they often, again, lose their mental and physical health and sometimes have to either decrease their number of hours at work or leave work altogether. And clearly that's not a great option for employers who have invested training and invested time into these workers. So again, in thinking about the opportunity to provide a caregiver-friendly workplace policy. It can, in fact, be as simple as changing the culture to be more nurturing, supportive, and caring, or it could be very innovative and creative with respect to setting up support groups, caregiver support groups, skills training in time management, for example, allowing flexible work arrangements if, again, the type of work allows it, supporting employees who are providing care, such as, again, educational workshops, lunch and learns, providing paid or unpaid leave, or again, sharing knowledge about the availability of such leaves. And then again, sharing knowledge about the availability of EAPs, insurance coverage, counseling, and so on and so forth. We also have recognized that for employers who choose not to be carer friendly, there's a number of different costs that ensue. And they include, for example, an increase in absenteeism, a decrease in employee retention, a loss of skilled employees, an increase in disability costs, and an employee turnover, as well as a less productive workforce. And in contrast, those employers who, in fact, do initiate changes to be care friendly, they have a number of huge benefits, such as an engaged workforce, reduced absenteeism, improved productivity, a retained skilled staff, competitive advantage, and a reduction in the number of employees coming to work sick. And so, again, it makes good social, ethical, as well as financial sense to be care inclusive. And I think having workers return to work post-COVID is an opportunity to unveil the existence of care employees, as we know that identification is one huge barrier to culture change, is having employees actually identify that they are a carer. So post-COVID presents a great opportunity for those who are, again, grieving or who continue to care or may have a loved one in ICU with COVID, or again, those long-term carers who have been able to get through the COVID period untouched. So again, it's about recognizing that many of your employees, in fact, may be wearing this caregiving hat in addition to being employed. And so some of the simple tips that are highlighted here is to emphasize the importance of work-life balance and promote a family-friendly workplace culture, to educate your line managers, your supervisors on policies, programs, and information available to carers, to allow employees to be aware of programs available in the workplace, such as the EAP or various other supports, as well as support their use. And then ask employees how you can support them. Very simply ask the question, what do you need and how can we help? And then accept diversity in the workforce, recognizing that, again, blended families exist, as do other types of families, whether they be LGBTQ plus or, again, multiracial. There's lots of variation in family life, and the care role can come in many different shapes and sizes with respect to who the care recipient is, as well as the type of social support network the caregiver has in managing their role. So one really important initiative that's been created back in 2017 was the creation of this standard. And so McMaster University partnered with the Canadian Standards Association to build the standard, as well as a handbook or implementation guide which accompanies the standard. And what this really is, it's a voluntary standard which provides a set of guidelines for any employer, irrespective of size or sector or workforce demographic profile, to basically put in place a care-friendly workplace. And there's a set of guidelines provided where, again, internal practices are reviewed, gaps and barriers are determined, objectives and targets are established. And again, awareness, competence, and training take place in order to realize, evaluate, and continuously improve the care-friendly workplace program or policy. And so both the standard and its accompanying implementation guide are available for free download on the Canadian Standards Association website. We've worked out a deal that this particular standard, either as a package with the implementation guide or individually, can be downloaded free of charge after inputting a number of different specs about your workplace. And again, it's probably 4 or 5 questions that's asked before you have accessible to the free download. So certainly a great tool to get you started on thinking about how to best respond to the care employees in your workforce. So one of our partners I mentioned earlier was Carers Canada, and Carers Canada, together with the Canadian Home Care Association, has been implementing the standard with their particular membership. For Canadian Home Care Association, it's basically the home care sector. And what they've done is they've really broken down the standard into 4 specific steps. The first being at the bottom of the slide, review current HR policies and practices. Again, do a environmental scan of what you currently offer. Number 2, engage senior leaders as champions. So the literature and our research suggests that the higher level executives or managers who have experienced being a carer employee are ideal champions to basically get behind such an initiative. And then third stage is to go to co-design the objectives and targets to fill in the gaps and recognize and address the barriers. So to create a committee with, again, care employees working together with the champion leaders. And then finally, after the creation and implementation, to communicate and raise awareness about, again, this program, this policy, these accommodations, this educational intervention, or again, whatever the individual workplace, irrespective of size or sector, determines to be what works for them in order to, again, be care friendly. So now I'll hand the reins over to Regina, who'll introduce herself. Thanks, Regina.
Hi, my name's Regina Ding. I am a third-year doctoral student with Dr. Allison Williams, and my research focuses on the health and consequences to workplaces, and looking at how interventions can be implemented in workplaces to improve these aspects. Doing is providing a brief background on the impacts of carer burden on the labor force. So Dr. Williams has already described that there are out there to help workplaces, and in general, workplaces are becoming more aware of the issue of carer employees. However, it's still not really the norm. And when there is a lack of organizational support for care employees, it's very detrimental to not only the carers themselves, but also the workplace. So one of the primary areas that is strained first by carer burden is the mental health of carers. So carers tend to be more vulnerable to poor health compared to non-carers, with Cs facing a lot more stress, and this is largely due to the fact that Cs are under tighter time constraints. So, under neoclassical economics, time is viewed as a limited, precious, and non regenerating resource. And Cs on this field are inherently disadvantaged because they not only have to their time between paid work and leisure, just like everyone else, but they also have the additional burden of caregiving. So that makes them a lot more prone to burnout. So for reference, the weekly hours spent caregiving for women in Canada is about 9.5 hours a week, and it's about 6.9 for men. So it's a substantial amount, almost equal to a part-time job, essentially, on top of paid work responsibilities. So, unchecked, poor mental health is costly to the workplace. So, an estimate by the Mental Health Commission of Canada found that employers may expect to lose $50 billion a year due to poor mental health. And now, CE burden is only a small portion of that number, but it's still there. It's still an issue, and it's still going to grow unless employers put in measures to prevent it. And this is likely an issue that's only been exacerbated since the onset of COVID, as COVID has resulted in significant transformation to the reality of work and caregiving. Next slide, please. All right, so I in the blue, these outline the individual impacts of caregiver burden on mental health. So, caregiver burden can generally result in increased depression, anxiety, fatigue, greater difficulty performing care work, sleep disturbance, poor morale, social isolation, loss of a sense of independence, and exacerbations in other kind of underlying conditions or other comorbidities. On the right side, red. So this column looks at the economic consequences of poor mental health resulting from care burden. And you can see there is a dollar sign symbol next to it because it indicates that it's a cost not only to the employee themselves. So these are costs that come out of the pocket of employees, but they also represent productivity losses to an employer as well. So absenteeism, presenteeism, and turnover are both costly to employers and employees. You have delayed career advancement, which disadvantages carer employees over normal employees. And then just overall reduced engagement with the workforce means that carers aren't working as many productive hours as they could be, or as they could be if they were supported in their caregiving endeavors. Next slide. Give a little bit more specific numbers. So, a report released by the Government of Canada using data from the survey found that in 2012, approximately 43% of Canadian CEs missed partial or full days of work due to caregiving responsibilities. Of 1.6 million carers took a leave from work due to caregiving responsibilities specifically. About 600,000 reduced their work hours, and 190,000 left the workforce altogether to provide care. So these are quite substantial numbers in a single year. It was found that in the report that these actually choose to reduce work if accommodations in the workplace are lacking. So if there isn't enough accommodations such as flex time or compressed work weeks in the workforce, or these services aren't well advertised, or there's not a very conducive work culture there. And that was really identified as a primary barrier by a lot of CEs in this survey, was that there generally was a lack of managerial support. There generally was a lack of employer awareness, so the employer not really understanding the depth of the issue, and as well an unconducive work culture where CEs weren't comfortable making use of available services because they felt that it would hinder their career advancement if they use these services. Next slide, please. All right, and a bit more numbers. So, in terms of economic consequences to employers, the Government of Canada estimated that total loss in hours worked equal to about 2.2 million hours per week in 2012. This is an equivalent of 157 time employees. So, a substantial amount of hours reduced because of caregiving obligations. Um, the cost of caregiving carer burden results in about $1.3 billion lost per year due to a combination of absenteeism, presenteeism, and turnover. There's an estimate from the US that guesses that employers may expect to lose about 2,400 USD per CE per year if the place is lacking in supports for care. In our own study, we conducted a similar study at a Canadian university workplace from our research group, and we found that the employer could estimate to lose about $8,674. That's in Canadian dollars per CE per year, just as an overall baseline. So these are pretty substantial numbers. And now these numbers are all calculated in pre-COVID times, but we can likely expect that a lot of these costs have probably risen during these uncertain times due to additional stressors. And next slide, please. And one of these foremost stressors that I want to talk about briefly is grief in the workplace, which is particularly salient right now during the COVID epidemic. employees, whether they're caregiving or not, might be dealing with grief and struggling with their work-life balance. Caregiving during COVID can certainly be very stressful as carers now have to care either at a distance, so virtually, or they might have invited their family members to move in with them, and now they have to kind of achieve sort of balance. Many employees may have also experienced a death in the family, just as a sheer number of deaths in long-term care. Overall vulnerability of older adults means it's very likely that people might be grieving right now. The end of life process and palliative care is very dramatic in non-COVID times as well, but this is further exacerbated because of additional measures put in. So many family members may not even be allowed to see their sick relative, and obviously, that generates a lot of stress, a lot of grief and anxiety. Normal social support networks may not necessarily be available right now because of our social distancing measures. So, this may now mean that work has become a stabilizing factors in employees' lives that give them a sense of normalcy. So right now, it's more important than ever for workplaces, employers, and supervisors to be sensitive, flexible, and adaptable to the needs of their employees, whatever that may be. Next slide. And if you are interested in exploring the grief of the workplace a bit more, we have partnered with Pallium Canada to promote the Compassionate Workplace campaign, which is an ultimate goal of creating more compassionate workplace cultures for employees who are experiencing caregiving, serious illness, or who may be grieving. So, this kind of campaign includes ready to implement resources and tools to help you, such as safe things to say tools, stories and activities, or a planning guide for employee work modifications for managers. And you have their website on the slide right there if you are interested in more information. All right, thank you.
Thank you, Regina. So now moving now to the tips and tools for employers. I know I've already addressed a few of them in some of the earlier slides, but we just want to wrap up by suggesting to first recognize carer employees as a critical component of your workforce and engender a carer supportive environment. Make it part of your corporate philosophy and show it with the interventions, the educational opportunities, the policies and accommodations that you provide. Be flexible and creative, not only with our program and policy, but also with individuals who require unique and tailored accommodations. Provide care employees with the necessary information about what is on offer and what is available, both within the workplace internally as well as within the larger community, if again this information is available and accessible. To evaluate your commitment to a care-friendly workplace environment at least annually and determine how it can be improved over time to meet, again, the gaps and the barriers that your committee and your champion have recognized. Know your legal obligations with respect to caring for family members as a human right, and recognize the impact that care employees have on your bottom line, recognizing again that it's not only a social and ethical imperative, but also an economic imperative to pay attention to this as a dynamic and ever-changing social phenomenon. And so now Regina is going to invite you to participate in her intervention study. Regina?
Employers who might be interested in promoting a more carer-friendly workplace. As part of my research, I'm collaborating with workplaces that adapt the carer standard that Dr. Williams mentioned early in this presentation and tailor to the needs of each of the workplaces. So we will work with the workplace to kind of find out your needs, your current policies, and then adapt the current policies that are in the standard to best support your workplace. And we anticipate that by implementing the standard as an intervention, we may see improvements in employee health, employee productivity, work satisfaction, productivity, um, supervisory satisfaction, and other work-related factors. So if this sounds like something that might interest your organization, feel free to contact me at my email below. All right, thank you.
Wonderful. And just to wrap things up here, I'd like to recognize our partners as well as our funders. I mentioned them at the onset, CIHR, SHRC, McMaster University. We also have a wide range of partners, and some of them are listed here. Also like to share some additional resources, including the UK document that we referenced at the onset, some tools that we have available on the research team website, ghw.mcmaster.ca, the actual standard and guide, again, in both English and French. And then finally, more information from the Carers Canada site specific to carer employees. So now we'd like to thank you for your time and attention. We really hope you've learned something, and we look forward to your questions. And before we take those, certainly we encourage you to connect with us electronically if you'd like to further engage with us in either Regina's work or in the work we're doing overall in encouraging care-friendly workplaces. Thanks very much.